Hello and welcome to Local Doctors on Call. I'm Alix Redmonte. Hip and knee injuries affect many people over the course of a lifetime. Whether you are an athlete or a sports enthusiast who has developed overuse injury or have a genetic or age-related problem, at some point you will probably need to seek medical attention. Dr. Ed Stolarski is a board-certified orthopedic surgeon. He specializes in minimally invasive hip and knee replacement as well as complex revision. So here to explain all of that to us is Dr. Stolarski. Welcome to the show.
Thank you for having me.
Oh, we are
Excited
delighted.
to be here.
Tell us a little bit about hip and knee replacements and why does that affect people, both the very young and the very old?
Majority of people, their hip and knee arthritis is due to wear and tear, just like their car tires. You come in and we change them. Certain younger patients with things like juvenile rheumatoid arthritis or polytrauma patients that have been injured have to have their joints replaced earlier.
Well, how young can someone be that has arthritis?
My youngest knee replacement patient is 14, and my youngest hip replacement patient is 15.
15 years old with a hip replacement. And
Actually, it was both of her hips.
Both of her hips, and this was due to arthritis?
Yes.
Wow.
Yeah.
And
Actually,
is this something?
hers was avascular and necrosis. Certain medications will hurt the blood supply to a joint, particularly the hips.
Now, explain, necrosis is when something
Death
dies,
is actually
right? The
death of the head, and
Okay.
it wasn't salvageable, and she collapsed and went on to have the same end result as an 80-year-old who had used her joint their whole life.
Wow. So it just basically wore away, wore down, and you replaced it. And when you replace it, is this something that needs to be redone over time, or do you replace it with natural?
Well, there's two parts of my practice. The young, active person such as yourself, then we do a primary hip or knee on. We're hoping for 25 or 30 years, especially on the hip side. Knees, maybe 15 years. So yes, they will need to be done. That's the other part of my practice is redoing the broken, the infected, loose, and worn out.
So, with the knee replacement in somebody my age, okay, so hopefully I'm not the worn out.
You still haven't told me that, but okay.
Yeah, okay, well, and we're not going to, not on television. But anyways, with the knee replacements or with just knee surgery in general and hip replacements on someone my age who is an athlete, how does that differ from somebody that maybe has a bone disease? Because you get a lot of people here that are young and fit.
Yeah, hips and knees are completely different when it comes to getting back to sporting activities in my mind. There was a good study put out in 1999 with partial knees versus total knees. 90-some% of people with partial knees went back to their sporting events. Only like 60% of people with total knees. Now that was done in 1999. We've come a long way. But knees just don't feel like God's given joint. Hips, on the other hand, do. You forget about your hip and you go back to the majority of your activities. So the hip replacements fortunately last long, let you get back to your normal activities and take forever to wear out.
So when you're doing a hip replacement, is it to do with the ball and the joint of the hip?
Yeah.
And do you actually put a piece in there to replace the ball part that fits
Correct.
into the joint?
It's what's causing the pain is what's rubbing on what. So you used to have nice, smooth, glistening cartilage. Now you have really just broken down chunks of bone and eburnation, or it's like marble. And it hurts, and your range of motion suffers, and you just have a lot of pain. That's the main reason to have your joint replaced is pain, not your x-rays or someone says you walk funny. So yeah, we resurface those. Hips and knees are both resurfacing. So the hip, we take the thing that looks like a cheese grater, get rid of all your old cartilage, put in a cup, an acetabular component. On the femur side, we actually put something down into your femur that holds a ball head, and that ball head articulates with the acetabulum, or the cup.
So you put in a fake ball head in there.
A new ball and socket.
Right. And I know that there are some kind of surgeries where you can actually take off the ball head and it grows the scar tissue that forms there. Can that be done?
Right. I think it sounds like you're talking about a girdle stone,
Yes.
where you just resect the femoral head. Veterinary medicine. Now,
Okay, so that doesn't go into the people one as well.
Yeah, the only time we do that is someone had major infections and we couldn't clear the infection, and we had to leave them without a total joint. It takes a number of years for them to even be able to ambulate with that.
Oh, wow.
It's not a good
In
option.
user-friendly terms, ambulate means be mobile,
yeah, walking.
Right. Alrighty. And who is some of the older people that you've worked on? How old have they been?
Probably in their revisions, well into their 90s. Primary total knees are the first one. I had a lady who was 94 and she did very well.
Now, I think that we should explain to the audience the difference between revisions and a surgery. A revision is when you go in and you fix something that was previously done, correct?
Correct. Either was put in wrong. It broke. They fell and broke something. We're out just like their native joint did. Then we go in and redo it. It's challenging. That's the thinking part of the practice. I mean, not really putting someone back together. I call them the island of misfit toys because they come from everywhere, and a lot of people feel like it's hopeless, and it's not.
And very often you're probably fixing perhaps somebody else's mistakes or something that...
I will tell you that I can't think of a surgeon I've ever met or read about that doesn't want a great outcome for their patients, but we're human beings, and sometimes things don't go in properly. It's rare, and we can fix them.
You know, we live in such a beautiful place here in Sarasota, and I know that you come all the way from Philly, etc. But when we get back from our break, we're going to discuss a little bit about these medical tourism vacations where people come, and we'll also be answering some of your emails that were sent in. So you are watching Local Doctors on Call, and we'll be right back with Dr. Ed Stolarski from Doctors Hospital. Stay with us.